but it is being recorded and will be distributed through the New Hampshire School Nurses Association channels. I would like to thank Paula McKinnon for providing us with this platform to give an overview of the program on how you can implement surveillance COVID-19 testing in your schools and districts by partnering with ConvenientMD. I do see a lot of familiar names on this webinar, and I want to thank all of you for the work that you put in daily to care for your students and the communities that you support. Again, I will ask that you please mute your microphones at this time. And at the end of the presentation, Dr. Pundt will take a few minutes to answer some of your questions that you have. So please direct those through the chat function on the WebEx. At this time, I would now like to introduce Dr. Mark Pundt, who will take over from here. Good morning, Dr. Pundt.
Good morning, everybody. Steve, can you hear me?
Yes, I can hear you.
Okay, thank you. Good morning, everyone, and thank you for joining us today. I will take you through a short presentation of the SASS program, the Safer at School Screening Program, and why it's important to your students, your faculty, and your staff, and how ConvenientMD can help you achieve safety in your classroom. One second. So obviously, safety is of utmost importance in the classroom, and protecting our students, our teachers, and our staff is a shared priority amongst us all. It's obviously a priority of the school and school systems, but it's a priority of the community as well as the parents and students and community partners like ConvenientMD. So we all have to be committed to creating that safe place for our students and faculty and staff to return to school, to maximize their safety and their ability to learn and enjoy this socialization of school. As you know, recently, over the last month, there's been a lot of information on the Delta variant. Right now, so as this program was developed back in late April, early May, the Delta variant was known to be in India only at that point, and much of the initial recommendations were based on a declining prevalence of COVID-19 in our communities. Over the past month, as the Delta variant has grown throughout the United States, currently, as of yesterday, 93% of all new cases in the United States are the Delta variant. This guidance needs to be modified for the safety of our students, faculty, and staff. Although the Northeast prevalence is below other areas of the country, it is still rising fast over the last few weeks. Vaccines. Vaccines are helpful in preventing and spreading infection. However, the Delta variant itself people who are vaccinated are not fully protected against the Delta variant. They can get sick and can pass the Delta variant on. However, it is much less likely that they will get sick enough to be hospitalized or have any negative outcome. So if you look at New Hampshire, 55% of New Hampshire residents are fully vaccinated. Obviously, those children under 12 cannot be, and therefore in the school systems, a significant portion of the student body will not be able to be vaccinated at this point. So we have to be concerned because unvaccinated people are a high-risk population, but now with the Delta variant, even those that are vaccinated are considered a higher risk population. In New Hampshire, we've seen 169 new cases over the past week. That's up in the range of 6 to 10-fold from a month ago. So the cases are rising quickly as compared to what they were in May and June. States like Florida and Missouri are experiencing significantly higher numbers of cases, partially due to the reduction of masking and social distancing laws earlier on, but also lower penetration of vaccinations. And one other thing to note of why it's important to be wary of the Delta variant is the initial COVID-19 variants, an infected person on average would spread COVID-19 to 1 to 2.5 other people. The Delta variant will be passed to 3.5 to 4 other people, and some studies are showing actually 6 to 8 other people. As you've probably heard, it is considered to be as contagious as chickenpox, whereas the initial Delta variant was as contagious as a common cold. There's been a study of an outbreak of the Delta variant in Cape Cod, which happened about 2 weeks ago. And this study is what prompted the CDC to determine the new indoor masking guidance, because viral loads amongst vaccinated people were found to be as high as those who are unvaccinated. If you look on the right-hand side of the slide, the total number of people deemed infected were 469. Of those, 74% were fully vaccinated people. 80% of those were symptomatic, and the majority of the cases were the Delta variant. This group of infections did result in 5 hospitalizations, 4 of which were fully vaccinated. However, the good point is none went to the ICU, and obviously, as you can see, none passed, which is the fact that there is some protection even in the Delta variant of our vaccination, but it doesn't prevent infection and the ability to spread. All this is important in determining the importance of a surveillance program in your schools. So the Safer School Screening Program. This is a governmental program that enables schools to choose partners like ConvenientMD to provide surveillance screening of their student body, their staff, and their faculty to determine early on if there's any individual or group of individuals infected, to quickly isolate them and prevent an outbreak in the school that can create negative outcomes for either having to close the school down or things in that nature. So this is a program that is funded by the government, so there is no financial burden to the schools. ConvenientMD has great experience in doing COVID-19 testing. Through the pandemic so far, we have tested over 700,000 people in New Hampshire, Maine, and Massachusetts. We have our own highly complex PCR lab in Salem, New Hampshire, which allows us to return results 98% of the time within 24 hours. And we have worked in the past and currently still work with many colleges, universities, long-term care facilities, and employers to surveillance test their team and personnel and residents in the same way that we would do with SASS, but obviously through different programs. So how do you implement SASS? Well, how is it done? So the first thing is to determine the target population. Obviously, it's going to include some students, some staff, and some faculty. When this was initially composed, the SASS program, again, back in end of April, early May, with a low prevalence of disease in New Hampshire, the high-risk people were determined to be those who were unvaccinated, number one, lived in residential schools, were in high-risk sports, which were contact sports, traveled out of the country, or when returning from a long break. That now has extended to even those that are vaccinated during this Delta variant surge, because as you see with the case study in Provincetown, 89% or 80% of those people were actually fully vaccinated. So we will work with you to determine that target population, but be thinking at least for the next few months that target population should really be everyone within the school system. By the way, recent information out yesterday, there's 4 predictions of what will happen with the Delta variant. If you observe what happened in India and is happening in Great Britain, that it will last somewhere in the 4 to 6 week range is one prediction. One is it'll last through the fall and early winter. And one is it's unknown how long it'll last, but it could even go beyond that. So being conservative, it's at least going to be a 2 to 3 month need of surveillance just for the Delta variant, but then COVID-19 variants beyond that will need continued surveillance. The second aspect is decide on frequency of testing. So the SASS guidance says that you should test 100% of your selected population each month. So whether that's doing 25% of that population weekly, 50% biweekly, but you should achieve monthly at least one test of the selected population per month. Implementing the on-site testing. We will work with you and we will set up registration online, consent processes. We will review with you and set up the logistics of getting the students, faculty, and staff to the swabbing site, configure that site, do the swabbing, and get all of the samples back to our lab. So we will minimize the work that you have to do. We are doing our best to make this a white glove opportunity and experience to the schools and school systems that choose to work with us. And as I stated, right now, 98% of results will return within 24 hours. As you know, as volumes of COVID testing wax and wane in the community, sometimes the return times modify with that or lengthen if there's a large amount of testing. Currently, we'll get 98% within 24 hours. We will return all results within 48 hours, even at high volume testing. How will students, parents, and the schools and faculty know the results? Number one, we will have two types of dashboards, of portals. One will be a student parent portal, so they can check their own individual results. One will be a school portal where the administrative personnel that are monitoring the program will be able to view a dashboard of the results of their students and faculty and staff. And then for any positive student, faculty, or staff, we will actually also call them directly to let them know they are positive and guide them in appropriate treatment and isolation. As we said, this is a team effort, and it is to do this correctly in an organized way and to minimize your effort in this. This program takes about 4 weeks from agreeing to utilize our services for this program to initiating the testing, about 4 weeks. So as you can see, to start at the beginning of the school year, we're about, decisions have to be made within the next week, and so as soon as possible. If one does want to do this program and signs up, but realizes they may not be able to get everything organized by day one, as long as we understand and work with you on the setup, 4 weeks from when we get the go that you're interested in working with us, we can have this working for you, your faculty, and students. What will we do in it? We'll design the logistics of that testing site with you. We'll do the online registration and consents. We'll provide the clinical staff all the PPE and testing supplies. We'll do the actual sampling and swabbing and courier them to our lab that day. We'll take care of all the medical waste. We'll do all of the reporting to the individuals, to the schools, and again, direct report of positives to the patients and parents of those patients, and obviously faculty and staff as well. What do we need the schools' help in? Obviously, organizing the students and faculty to go online to do the registrations. We need assistance with flow control as people come through the testing site. That may be in a gymnasium where they're on foot, or we've also done drive-through testing as well. So either way, we'll need the school's assistance with traffic control. We need, again, to communicate the need of the parents, faculty, and staff to pre-register and sign the consent form ahead of time so that we can very efficiently obtain the samples. By the way, these samples also will be obtained anterior nasal, so they're the most comfortable method of obtaining a swab for the students, faculty, and staff. We also will need the schools to communicate to the faculty, parents, and the community that they are in the SASS program. We'll be doing surveillance monitoring to keep their school as safe as possible. And then we'll also need access to power, Wi-Fi, and a household waste bin from the school. There's some frequently asked questions that we'll answer for you, and then we'll open it up from there for questions from the audience. Steve, will you begin the questions?
Of course. And, I just want to reiterate that, ConvenientMD and you guys in the schools and the communities, we do, share the goal of in-person learning, and that is really paramount. to this program is the emphasis on getting the kids back in school and doing so safely through the surveillance testing. So the first question that we get a lot is this really at zero cost to the schools and the districts out there, Mark?
Yes, as I stated, this is funded by governmental funding from the federal government through the New Hampshire state government, and the school system, parents, staff, and faculty do not have to pay anything toward this. The entire cost is covered through this program.
So I know we've addressed this before, but I think a little bit more clarification would be great, comparing what the initial SASS guidance was for your targeted population. So if you can just talk about who should be tested and how that pertains to those who are vaccinated.
Yes. So as this program was developed, it was defined that those who were unvaccinated, they defined high-risk populations as unvaccinated individuals, those who live in residential schools, returning from a long vacation, whether that's summer vacation or a vacation that is over a week's time in length, those who students, faculty, staff who travel internationally or go on a cruise. However, now, and then of course sports, right? Contact sports. So sports like football, soccer, where there's basketball, a lot of contact. Those were high risk. With the Delta variant, though, and the fact that we know that even if you're fully vaccinated, you can become infected, be symptomatic, and pass that infection on, we now have to consider pretty much our entire population high risk until the Delta variant fades. So the need and importance of surveillance is even higher today than when this program was put together.
Fantastic. Thank you, Mark. And so just to reiterate, those who are vaccinated are eligible for testing through this program. Now,
Yes.
there's been a couple of questions about those who are symptomatic, Mark. And so what about those that happen to come down with symptoms?
Yes. So students, faculty, staff who have symptoms should not come into school that day. They should contact either ConvenientMD for evaluation testing via our virtual or in-clinic opportunities and services. They can obviously contact their primary care doctor or pediatrician for evaluation testing as well. But they should be evaluated and tested before returning to school to ensure that they're not infected. If they are infected with COVID-19, Delta variant or other, they should be isolated until they have no fever and an improvement of symptoms 10 days or more after their symptoms began.
Thank you, Mark. And a question that came in via the chat function. And so I encourage you all to open up the chat function if you guys have questions that you would like Dr. Pundt to address. But one question that came in, Mark, is does the SASS program cover this symptomatic testing? And would ConvenientMD be willing to provide a standing order for rapid testing? You know, we had talked a little bit about this before we signed on to the webinar, Mark. So maybe in the event of a potential outbreak, how would ConvenientMD approach that?
Yes. So the SASS program does not cover symptomatic testing. Symptomatic testing it has to be done through another mechanism, such as our virtual care and our in-clinic bricks and mortar settings, and again, through other clinical settings like your pediatrician or PCP. We do have the ability to work with you to arrange that through our clinics and virtual care network. However, again, it is not a service directly provided by the SASS program. It is something that we do every day in the community and can help each school system and individuals with that when needed.
Fantastic. Now, at this point, most of us have probably been tested for COVID-19 in the past. Can you talk about what test we use and how the sample is collected?
Yes, so I'll start with sample collection. As I stated, it is an anterior nasal swab, so the most comfortable of types of swabs that one can have to gather the sample. And then we use the gold standard PCR testing. PCR testing is a molecular testing that has been a gold standard since I think 1994, and for COVID, obviously, since it's begun. Therefore, that is why we use it. It is the gold standard test.
Fantastic. And again, just to reiterate how often we need to test, the DHH guidance suggests testing 100% of your predetermined population. But Mark, can you explain that, ConvenientMD can work with a school to, one, determine that population and then figure out what cadence is best for that district?
Yes, yes. So the first thing is to determine with the school administration which population is going to be tested, and who we determine to be high risk. Obviously, I've suggested who it makes sense to determine to be high risk during the Delta variant. If the Delta variant should fade through the school year, then that definition will likely flux and flex. And we will work with you to define that and redefine that if needed. Once that's defined with the administration, then we can set, knowing the volume of student, staff, and faculty, and the understanding more of the logistics of that school or school system, we can define with that school and school system the cadence of testing, whether that be 25% of that high-risk group weekly, whether it's 50% biweekly. That will be done in concert with the school or school system.
Okay, fantastic. And, we've spoken with a lot of districts out there, and, one of their concerns is that, their administrators or their school nurses may not have time to administer these tests on their own. So does the school or the school district need to hire any additional staff in order to implement this program?
No. To implement the ConvenientMD program, no new staff will need to be hired by the school or school system. We will need a point of contact to help us with all of the logistics and the coordination that we have talked about through this presentation, but there should be no need to hire additional staffing.
Okay, fantastic. And just to reiterate, the results will be made available directly to the parents and the guardians, directly to the school administrators via a dashboard, and we will be calling all those individuals that may happen to test positive. And our turnaround time is between 24 and 48 hours, with 98% of those results being returned within the first 24 hours. So thank you, Mark, for answering those frequently asked questions. And I'm going to turn over to the chat board and some questions that our audience has asked. So the first question is, do we recommend this process in lieu of masking? And maybe, Mark, you can talk about the decision that we have made internally at ConvenientMD regarding masks.
Yes. So recommendation currently is no. You should do masking plus surveillance testing. That recommendation is as you know, new within the last week to 10 days from the CDC relating to the Delta variant. So as an example, at our clinic support center, our corporate office at ConvenientMD, we had removed the indoor masking requirement in the late spring as the prevalence of disease had decreased. However, and we have in the range of 97% of our team vaccinated. Despite that, yet 2 days ago now, we reinstituted the mask mandate within the corporate office to prevent spread of basically the Delta variant. We would have a similar recommendation for the schools until the Delta variant fades. Surveillance testing should be done during the Delta variant, though, and beyond, because again, there's other variants out there. There's a new one coming up, Lambda. We're not sure of its infectivity. So surveillance needs to be done currently in concert with masking. There is a potential in the future, if disease prevalence fades and the Delta variant fades, that we may be able to loosen up that mask mandate, but continue surveillance.
Okay, fantastic. And now, Mark, is this program voluntary?
Yes. Yes, the program is voluntary from the school and school system standpoint. It is also voluntary from the student, faculty, and staff standpoint.
Fantastic.
So an individual can also choose not to participate.
And ConvenientMD will be providing, consent forms to the guardians and the parents of the kids that have elected to participate in this program. So ConvenientMD will work with the school to get those consent platforms in the hands of the families in your districts. Now,
Yes.
what if I'm a small school, Mark? Let's just say I have 150 students and staff. Would ConvenientMD be able to test all of those students in one day?
Yes.
Yeah, so ConvenientMD will provide the necessary personnel to test your targeted population. And so once we determine that population, we have the bandwidth to test certainly 150 students per day, and even more depending on what the need is. So we do have a number of larger districts that have a significant size targeted population. And so ConvenientMD will be able to appropriately staff our team to test your targeted population. Um, a question, Mark. Can a school or district sign up for this program, but choose not to initiate it right away?
So yes, they can, and we will work with any school system or school that's interested in being in the program. However, it will take about 4 weeks to initiate from when it's a go, because as we are working with many schools and school systems in the state, we are ensuring we have the capacity to do the testing, provide the team to go out and do the appropriate testing at the appropriate intervals for the schools that we are involved with. So if there's a school that's not in the regular surveillance program now wants to start up, it will still likely take that 4-week time frame. So the school systems need to understand that it's not we can go tomorrow, because of capacity constraints and the need to plan to meet that capacity.
Okay, fantastic, Mark. I'm just going to scroll through here for a quick second to see if there are any other questions. Something that did come across, and I'll answer this one for myself. But so, how does the school go about signing up with ConvenientMD for this program? Is there a contract or an agreement? And the answer to that question is yes. There's a very simple testing agreement that would be put in place between ConvenientMD, the provider, and you as the school district or the school itself. And that agreement essentially outlines what the protocols are that are in place, the testing frequency, and how we are going to go about implementing that testing. So it's a pretty simple testing services agreement that we would have with the school and the school district. As a follow-up, is this, not to that question, if I could just ask those of you, I'm going to mute all, so Mark, you may have to unmute yourself, but we're getting a little bit of feedback here. Okay. Okay, so another question that just came in at the end, and I encourage you guys to submit your questions as we are getting towards the end of this webinar. But is there a minimum number of people that need to be tested in order to participate, to make this a viable option?
So are we asking like from a percent of, do you think the focus is what percent of the school personnel and students, or is it like a hard number, we have to at least test 100 people? Because the answer is, from a percent of school, it's the more you can surveil, the earlier you can detect disease, and the earlier you can isolate and prevent spread. So there's not it has to be at least 50% of the school, or 25% of the school, or 75% of the school. And there's also not a minimum number from a testing on a routine basis. We will find a way to accommodate your needs if you're a smaller school or a large school system. Okay,
fantastic. Well, Mark, I just wanted to thank you for jumping on with us today and answering some questions and going through the SASS program and the ease of initiation with the school. However, I will reiterate that it does take us a little bit of time to ramp up to make the decisions with you guys as administrators. And so if there is interest in this program, we encourage you to reach out to ConvenientMD. You can email us at the email addresses that you see on your screen, or we do have a dedicated SASS email address, which is simply sass@convenientmd.com. So if you have any follow-up questions or would like to schedule a one-on-one call to discuss this program in greater detail, please utilize those email addresses. So I just want to thank everyone for participating on this morning's webinar. We have recorded the webinar, and we will send it over to Paula to distribute to those that were unable to make the morning's chat. But again, we wish you all a safe re-entry to the school this year, and appreciate your time meeting with us this morning to discuss the SASS program. Have a great morning.
Yes. Thank you. I want to thank everyone as well for participating, and we look forward to working with you if you should choose us to assist you with the SASS program.
Thank you, Mark, and I hope everyone has a great rest of the day and week, and a safe school year this coming year. Have a great day.